It is with great pleasure that I introduce again Dr. Pai and Dr. Rasmussen. Dr. Pai is a registered psychologist specializing in neuropsychological assessment. She is also an assistant professor in educational psychology and assistant clinical professor in the Department of Pediatrics at the University of Alberta. Dr. Rasmussen is an assistant professor in the Department of Pediatrics and member of the Centre for Neuroscience at the University of Alberta. She is also a research affiliate at the Glenrose Hospital. Please join me in welcoming Jackie and Carmen.
Good morning, and thank you, Colleen. All right, it's good to be back in the third of our series on cognitive interventions, and today we're going to talk a little bit about math. I'm going to begin. There we go. I always have to orient myself as I get started. We're going to begin just by taking a look at our session goals. And much like the previous sessions, if you've been with us before, we will talk a little bit first about why we look at evidence-based intervention and kind of set ourselves in a role that casts you, the teachers or service providers, in the role of scientist as well as us. And so we'll start with that place, and then we're going to talk a little bit about math impairments with FASD, talk about research interventions with math and in general, as well as talking about how we can apply what we know to practice, and that's where we'll talk about some strategies. So, same kind of plan as we've had in previous sessions if you've been with us. And so these first couple of slides might be review for some of you. If you're new, I'm going to go through them quickly, so bear with me. You're always welcome to email questions specific to this if this is your first session and you feel like it's going really quickly. But for those of you whom this is review, I just want to remind us as to some of the real foundational things that are, I think, really crucial when we're thinking about intervention. First of all, when we talk about intervention, we're talking about three things. We're saying, is there research efficacy, meaning do we have scientific evidence that it works in a lab? Can we kind of make sure that if I do this intervention, if I provide this math intervention in my lab to this child, will their math skills and their ability to do math improve as a result? And I pre-test it, and then we do an intervention, and then I post-test it, and I maybe post-test it again to say, yep, guess what? This intervention works, their skills get better. Then we get to meaningful effectiveness. Number two, really important. Just because it works in my lab, is it going to work in your classroom? Those are two very different settings, and so just because something shows some effectiveness or efficacy, scientific evidence in a lab, doesn't mean it works in real life. Once I put somebody in a classroom full of children, is this the same approach going to be effective, or do we need to make some changes, or what will that look like? And that's what I talk about that one as being really, really crucial, because that's where the importance of partnerships and collaborations and working together are foundational to that kind of information. Research into or examination of how something is meaningfully effective cannot just happen at a research level. It has to happen at a partnership level between people who have perhaps some knowledge of research, but those individuals who are actually doing the work. And finally, a third piece when we're talking about interventions is feasibility. And we've talked about this before. We may have a brilliant intervention that works fantastic in the lab. We have some great math cap that we put on the kids, and they wear this hat and their brain just does math better or something. And then they go in the classroom and it still works and it's brilliant, but it costs $1 million a child. That may not be feasible, and we may have to come up with some alternatives. So feasibility, or if it takes four educational assistants to support the implementation of an intervention, we may find out that it's not all that effective. So when we're looking at it, we can say it works in the lab, does it work in a classroom, and what would it look like to have it in that classroom on a regular basis? Is it feasible? Is it feasible that we can integrate it into our system? Because ultimately, anything we do into intervention research is geared towards changing the way we do our practice day to day. And if we're not getting information that informs our practice, then what's the point? And I always ask that ultimate so what question. What's the point? And so when we're talking about intervention, sometimes we're talking about lab work, sometimes we're talking about applied work, and then sometimes we get to questions of feasibility, and often those are the questions you will ask. And you'll come back to us and say, yeah, but how does this work? Or yeah, but how do you address this issue? And that's, again, where partnership, collaboration, and relationships become crucial to any kind of intervention research that's going to have any sustained impact on our practice. Research-derived evidence is still emerging. What that means is work that Carmen and I are doing, research that's happening in the lab, is still emerging, and in fact, it's still in its infancy, and there are very few of these lab-based evidence-type studies. But this does not need to be the only source of evidence, and this has sort of been my mantra, for lack of a better word, for these 3 presentations. If all of you practitioners are waiting to hear from us as to the best strategy to use in your classroom or in your home, you'll be waiting a very long time. We have some information, we can provide some evidence, we want to talk about it, but we need to go beyond what we can provide in order to inform practice today. Over time, we're going to have better and better information, but time is not always what we have. And so what we need is to build these relationships that allow you as the practitioners working in the community, working in schools, working in homes, to begin capturing those interventions and those successes that you are having so that we can communicate that information to other practitioners. So that those ideal interventions are not simply coming from us and saying, hey, this is what you need to do, but rather everybody. That scientist model, all of us can be scientists, not just the researchers. You as a teacher, as a caregiver, service provider, whatever your role may be, can adopt a scientist role where you start to say, what am I doing? Is it working? How do I know it's working? How can I monitor and track the fact that it's working? And then how can I communicate that to others? We can all engage in that kind of process. And so that's been one of the things we've talked about through all these sessions, and I've introduced you previously to this idea of invest in your intervention efforts, where we've talked about things that when you're doing an intervention, be intentional or at least aware of stuff you're probably already doing, but be a little bit more intentional about how are you identifying the key problem and the goals that you have. What are you trying to accomplish by doing an intervention? What is an indicator of success? How do you know things are getting better? So if you think the problem is math and there's a difficulty in math, what's your goal? Where do you want to see their math get to? What kind of improvement are you hoping to see? What do you think the impact of that improvement is going to be? What are the indicators of your success? How will you know whatever you're doing has worked? They do better on a math test? They don't get so frustrated in math class? They come to math class? What will that look like? How do you validate assumptions? If you think something is going to work, or you say, well, I think they're going to come to math class more if they're having greater success in math, you're assuming that they're not coming to class because they're frustrated. Are you right? Is that what's happening? Ask your coworkers, ask the people that you're teaching with, ask others. Does that make sense? Yeah, I think it makes sense. Okay, I'm going to try this intervention. Because we need to communicate. We can't operate in a vacuum when we're thinking about these things. Try your program. Try your math intervention, for instance, and we're going to talk about some ideas and some suggestions today. Try those things, and then measure afterwards. Did Johnny come to class more often? Did Johnny's math performance improve? Did he do better on his test? If he did, and if he started coming to class, you're like, wow, bonus. This works on 2 levels. Let me try it with another child. Let me measure this again. Oh, it worked again. And I'm going to try it again, and guess what? It worked again. I've gone through 3 kids. I'm going to start telling people about this. They need to know that when I do this, math grades go up and attendance improves, or frustration. That's important information, and you'll know what those kinds of successes look like. All we need to do is start tracking them and thinking about it. So the INVEST model is just there to help you organize and be more intentional about writing things down and then thinking about how we can communicate. We can look at the outcomes. We can say, how can we tweak that intervention? Because sometimes something doesn't work totally, but it works sort of, and we just have to manipulate it a little bit. And then we want to transfer that learning. And that's what becomes really crucial, is how do we then communicate it? Because if you're doing something brilliant in your classroom, for example, we need to share that. We need to somehow capture that, and we need to let other people know and communicate that information so you guys can be learning from one another. Because that's exciting, and that's how our practice is going to evolve. And Carmen and I want to hear about it, and we want to know what's going on and what's successful so that we can make sure that that information gets out there. And at the end of the presentation today, I'll speak to a couple of places that we can start to use to communicate that information. But we're also going to be interested to hear from you. How do we get this information about your interventions that you have invested in between all of you? How do we share that information? How do we start moving that around in a way that influences practice? So at the end of the presentation, I have some ideas, but I certainly welcome questions or suggestions or things that you guys bring in. But our first step is I'm going to turn it over to Carmen right away, and she's going to talk a little bit about math and FASD, because in order to set goals and in order to identify a problem, we need to understand the possibility. We have to understand what's at the root of it. So beginning to pursue an intervention first requires an understanding of the issue at hand so that we can set goals that are appropriate and are the right fit for the kids that we're working with. So Carmen will take us away with all the really interesting things here now.
Thank you, Jackie. I'm just going to set up my stuff here. So I'm going to begin today by just briefly reviewing some of the research on math deficits in children with fetal alcohol spectrum disorder or with prenatal alcohol exposure, because all of this research isn't necessarily only conducted on kids with a diagnosis. There's a lot of research on children with prenatal alcohol exposure, but that do not have a diagnosis. So we do know that math is a particular area of difficulty for kids with FASD and for those with prenatal alcohol exposure. I'll just use PAE to refer to children with prenatal alcohol exposure. When we look at the research, math deficits tend to be more pronounced than other areas of cognitive deficit in these children. So of course, children with FASD, they have difficulties in memory, language, they even have difficulties in reading. They have difficulties in a lot of different academic and cognitive areas. But when you look across the board and across studies, math turns out to be an area that tends to be weaker than most other areas. So even though they do have global delays, we do see math. There's something unique going on with math that makes math even worse than other areas. Okay, and when we actually look at the longitudinal research conducted by Anne Streisguth, she's conducted a over 30-year longitudinal study of over 500 individuals with alcohol exposure in the Seattle area, and what she found over the years, they tested the children at various ages on many different cognitive variables, different areas of academic achievement, behavior, and what they found is math was one of the variables that was the most highly correlated with the amount of prenatal alcohol exposure. In her research, because it was started over 30 years ago, they actually interviewed women during pregnancy to ask them specifically about how much they were drinking during pregnancy. So they have very good data on that. And the math scores were very highly correlated with amount of alcohol exposure. Can everybody hear me, or is there, okay, sorry. So, I mean, what that means is basically the more alcohol that a mother drank during pregnancy, the worse the math scores in childhood. So there definitely is some pretty significant evidence for something unique going on here with math. Again, when we look at some relative to their IQ, children with FASD tend to do worse in math than predicted based on their IQ. So even once we take into account and we control for their general overall intelligence, they still do poorly in math. So it's not just that they're doing poor in math because they have a low IQ. They do poor in math even above and beyond what their intelligence level is at. Okay. Another thing here, based on Streisguth's longitudinal research, is that these math deficits persist. So they've been documented in her study in children with prenatal alcohol exposure as young as 4 years of age, and she followed those children for 30 years. They're all adults now, and the math difficulties persisted through adolescents and adults. So they definitely do not go away, and that obviously highlights the importance of intervention research in this area, because this is a really robust deficit. In one of Anne Streisguth's studies of adults with FASD, she found that their average math performance was at the second grade level. So you can just imagine the type of difficulties that this would cause in a person's everyday functioning if they have math skills at around the level of a second grader, which, I mean, just the ability to adapt and function in society is definitely going to be compromised. Sorry, just to continue on there, in terms of things even like telling time, counting money, managing your finances, all of these things that we kind of take for granted that just come naturally to a lot of people would be very difficult if you're math skills are at the level of a second grade level. Now, of course, this does not mean that every adult with FASD has their math is at the level of a second grader. This is in one study conducted in the States. But again, it just shows that the math difficulties are present and they do continue through adulthood. They don't go away. So why is math such an area of difficulty, and what is unique about math and FASD that math is one of these areas that is quite impaired in these individuals? There's a couple of different theories out there. There isn't a lot of research on the underlying causes or roots of the problem, but there is some. So Burden et al. Have conducted some research showing that math difficulties in FASD may be related to an overall slower processing speed and efficiency of information. So individuals with FASD are slower to process information, and they don't process it as clearly or as efficiently, and this is related to their performance on math tasks, but also on other tasks as well. So that is one theory that's put forward. There's very little research looking at underlying brain function in FASD in relation to math. When we look at other populations, in typically developing individuals or individuals with specific math deficits, we do know that there are certain areas of the brain that are involved in doing mathematics. So specifically in the left parietal area, and in particular, the interparietal sulcus is found to be involved in math skills in other individuals. And so lesions in this area of the brain can lead to math difficulties. And so based on that knowledge, the general neuroscience underlying math function in other individuals, we actually conducted a study, Kable et al. This was conducted here at U of A with myself and Christian Bouliot and Gail Andrew and other investigators. And we looked at whether or not the white matter tracks in this specific area of the brain that we know is involved in math in typically developing individuals, whether or not that was related to the math difficulties seen in children with FASD. So we specifically looked at white matter tracks using diffusion tensor imaging in the left parietal area in and around the interparietal sulcus, which is really this math area of the brain. And we actually found that first, of course, the kids with FASD did have difficulties with math, and their difficulties were highly correlated with the integrity of the tracks in this area of the brain. So this was a really, really interesting finding because it's the first time ever in FASD to link the underlying brain function to their math performance. Okay, and so we published this paper last year. Really exciting findings, but of course we need a lot more research in this area to look at it further. But again, this is directly showing that we know that prenatal alcohol exposure affects the brain. We know it affects the integrity of the white matter tracks, and now we've been able to show that the integrity or the quality of these white matter tracks is directly correlated with their math performance. So this is this area looking at the underlying brain function in FASD in relation to these cognitive difficulties is an area that is really just starting to take off. And again, hopefully we'll have more research in this area, but that was a promising finding. And then another suggestion is that these math difficulties are probably related to overall executive functioning difficulties seen in individuals with FASD. So when you have difficulties with executive functioning is obviously one of the core deficits in FASD. So they have difficulties with things like planning, reasoning, judgment, working memory. And so other researchers suggest that executive functions may play a critical role involved in math. You need to plan, you need to be able to reason, and do these skills in order to do math. So, but this hasn't been researched a lot. This is one theory that's out there, and I think that it makes a lot of sense, and it's probably a relation of a lot of factors. There's not just going to be one specific factor that we're going to pinpoint, but executive functions definitely probably plays a role. And when we actually look at one type of executive functioning, which is working memory. So remember, working memory is just your immediate short-term memory. Basically, as you're processing and remembering what I'm saying right now, it usually is 7 plus or minus 2 items long. That's kind of your memory span. So if a person says a phone number to you, you will usually repeat it in your head and try and remember it. And what you can immediately remember from that phone number is really your working memory. And so when we look at other populations, we do know that working memory is actually highly correlated with math performance in non-exposed, typically developing children. So working memory is important for doing math in other populations. And when we actually look specifically at children that have diagnosed math disabilities, it's also directly linked to impairments in working memory that they have. So we do know in other populations that working memory is one contributing factor to math disability. So in the next study that we did, we thought, well, based on what we know, let's go and test to see whether or not working memory is a contributing factor to math difficulties in FASD. And if you remember to our first presentation on memory, we talked about different research on how to improve working memory in children with FASD. So we can also look at applying that research here. If working memory is found to be a contributing factor to math difficulties, not only can we improve math difficulties, but we can also look at improving their working memory, which could in turn improve math difficulties. So what we did in this next study is we basically wanted to look at the relationship between working memory and math in children with FASD. This was conducted actually with my PhD supervisor, Dr. Jeff Bisanz. And we had 21 children with FASD and 20 controls aged 4 to 6. So in this study, we looked at quite young children. Again, you might be thinking, well, what kind of math problems is a 4-year-old doing? So let's take math as a very broad term, not just arithmetic, which is actually solving math problems, but also understanding math concepts, understanding numbers, counting, So obviously these math skills, they actually start quite young. My toddler is doing math. He's counting and things like that. So they start young. It's not just arithmetic. So what we did is we looked at measures of math from the Woodcock-Johnson tests of achievement. So we had a couple of measures of math achievement there. And then we looked at a working memory battery. So the working memory test battery for children, which looks at 3 different components of working memory based on Baddeley's model of working memory. And the 3 components involve the phonological working memory. So that's really your memory for verbal-based information. So as you're remembering what I'm saying right now, if I tell you a list of numbers and then you repeat the list back to me, that's your phonological or your verbal working memory. If you're trying to remember a shopping list, again, an oral shopping list, then that would be your phonological working memory. So a common way to test that is you just give individuals random lists of numbers to remember, and you see how many numbers that they can immediately recall. And we talked about that in the first session, and that's really your memory span. Another component is the visual spatial. So no verbal information, but being able to remember the visual spatial information. So there's different ways to test this, but one way would be an individual touches an array of dots on a piece of paper, and then the other individual has to reproduce that. So they're remembering not the numbers, but visually what the experimenter did. And then the central executive really involves some of the more classic executive functions. So it involves the immediate short-term memory of information, but it also involves sometimes some inhibition and some manipulation of the information. So it kind of takes it a step beyond just the recalling of information. So there are a number of different tasks to measure more of this central executive component of working memory, but a simple way to, one task that I guess would be easy to explain would be in the phonological task, you have individuals remember lists of numbers. So when you add this central executive component, they have to remember the list of numbers, but they have to repeat it back to you in the backwards order. So you can say you have to remember the information, but also manipulate it because you have to start at the end. It's much more difficult to recall the list in backwards order. If I give you a phone number and you're repeating it in your head and then I say recall it in backwards order, you have to manipulate and really think. And so that involves more of the central executive. So we measured those 3 types of working memory in children with FASD and as well their math performance. Okay, so first of all, the first figure, this is from our paper, we found that children with FASD were significantly lower on all tests of math relative to controls. So this really confirms the previous research that they do have difficulties in math. The average scores are around 100. That's where the average standard score should be. So our controls were doing just above average, and the FASD group was usually in the mid 80s. So they were usually about 1 standard deviation below the mean, which is quite impaired. And we looked at different types of math. So the first one is applied problems. So this was solving very basic math problems. So the older children may actually be doing some adding, subtracting. The younger children may be just doing some counting. And then the quantitative concepts gets more at understanding the conceptual side of math. So understanding different math symbols and formulas. And then the math reasoning was an overall composite of those two. So this isn't really anything new. Yes, they're having difficulty in math relative to controls, but more importantly, what we looked at is how did working memory contribute to this? First of all, when we look at the working memory measures, children with FASD were definitely also impaired on the working memory measures relative to the controls. So first of all, they had overall difficulties in working memory. But when we look at how the working memory correlated with the math, it was very, very highly correlated with how they did in math in both the controlled children and the FASD children, but much more so in the FASD children, which was interesting. There are many more correlations with working memory among the FASD group than the control group, which suggests that working memory might even be more important for math in FASD children relative to controlled children. It was correlated in both groups, but much more in the FASD group, which was quite interesting. And it mainly was correlated actually with the phonological and the central executive working memory, so the verbal based working memory, as well as looking at more of the executive functions and manipulation of information. We found less correlations actually with the visual spatial working memory. That doesn't mean that the two aren't related. They probably are, but we only had one measure of visual spatial working memory in this study, so we'll have to look at some other measures of visual spatial working memory as well. So this study was one of the first studies to show that working memory does appear to be one of the underlying factors that contributes to the math difficulties in kids with FASD. And like I said, there's actually a lot of research out there looking at different interventions on how to improve working memory. So if we just do some simple improvements in working memory in these children, perhaps it can also lead to improvements in other areas, like mathematics. Okay, so this leads nicely into the next part. I'm going to talk about some of the math intervention research. So like I said, we know working memory is an underlying factor. In our first session, we talked about ways to improve working memory, and there's quite a bit of research on ways to improve working memory in other populations, and then a little bit in FASD. So that's one way that we can look at improving math. But we can also go directly to the math and look at, okay, let's look specifically at math skills and see how we can target those as well to show improvements. So fortunately, there's a very great study that was conducted looking at a math intervention program for children with FASD. It was conducted by Julie Kable and Claire Coles, who are well-known FASD researchers in the States, in Atlanta. They run a very large program there of intervention research and brain imaging research, and are quite active. And we've actually been collaborating with them. This study was conducted with them, not in collaboration with us. This is their study. And so what they did is they actually developed a math intervention program for children with FASD. So they have a teacher and educators on their team as well that they actually worked with to come up with this novel program. So they put a lot of work into this, and it's a very great program. It's called the Math Interactive Learning Experience, or the MILE program is what I'll refer to it as. And it has been tested in Atlanta in their population, as well as in they've replicated it in other sites across the states. And we will be looking at replicating it here in Edmonton as well, and I'll get to that in a bit. So what they did is they had children, again quite young, age 3 to 10 with FASD, and they just randomly assigned them to 2 groups. So the first group received this MILE math intervention, and I'm going to talk a bit more about the intervention coming up. And the second group is their control group, because when you're doing this type of research, it's ideal to have another group that doesn't have the interventions so you can actually measure change relative to a control group. So their second group, their control group or contrast group, was their, they called them the standard psychoeducational group. So they still received some benefit from being in the research study. They received an individual education plan and a neurodevelopmental evaluation from their team, but they did not receive any special math intervention. Okay, so they had these 2 groups. And then what they did is they had 6 weeks of individual tutoring in math for the MILE group. And they didn't just tutor them in math, but they tutored them on other cognitive deficits that are related to math. So things like their visual spatial abilities that we know are related to math as well. Now, when I say individualized tutoring, this was one-on-one tutoring that was conducted with a trained researcher, educator, a person from the research team that was trained. And they actually did pre-testing with the children to find out what their starting level of math ability was. Because remember, the children were aged from 3 to 10. So what you're going to do with a 3-year-old is going to be very different than what you're going to do with a 10-year-old. So they actually had, each program was individualized as well to each child. So based on the pre-testing, you can determine where you need to start and what skills that child needs to work on. So even though we know that kids with FASD have difficulties in math, there is still a lot of variability in there. So some children may have more difficulty with conceptual side and whatnot. So they had it very individualized to be tailored directly to the needs of each child. So it was a very great program. I'm going to talk a bit here about some of the general things that they did in the program, but Jackie's going to go into it in more detail. And I mean, anybody can go look at the paper. The reference is at the end, Kable et al., published in 2007. But overall, what they did in the program is they, like I said, they had specific tutoring in math, as well as these other difficulties that are related to math, visual, spatial, working memory. They used a slower pace of instruction to compensate for this processing speed difficulties in kids with FASD. So remember that research by Burden et al. That actually showed that math difficulties may be related to an overall processing speed difficulty. So they took that into account. They used a lot of physical objects and tools to help with memory and with their visual spatial deficits, so things like number lines, and Jackie's going to go and show you a lot of those different tools that they used. They used a lot of repetition in both verbal and visual domains. So if they did something verbally, then they did it again visually to get at both kind of aspects of memory and math, and to hopefully have more repetition that would assist in the learning. And then they also assisted with their poor graphomotor skills. So not just understanding math, but being able to hold a pencil and write properly on a piece of paper and have the numbers lined up, and those things also will affect your math. So having difficulties with fine motor and being able to represent numbers and stuff on a piece of paper is also going to affect your math skills. So they also assisted with them on that. So like I said, they had 6 weeks, and these were one-on-one sessions, which I think were about an hour and a half each. And I believe in this version of it, they had 10 sessions over the 6 weeks. So it wasn't tons. It wasn't like every day, all day. It was, you know, around 10 sessions over 6 weeks. So, and remember, during this time, the other group was just receiving general recommendations for overall academics and individual education plan. Another thing that they had is they had a parent component to the study. So all parents actually, it was mandatory to be in the study that parents had to come to 2 workshops on FASD at the start. So this was great. They had an overall workshop on FASD, and then they had another workshop that was specifically focused on understanding the math difficulties in FASD and how to improve them at home, whereas the contrast group just had more general FASD strategies because they didn't want to teach them about math, because remember, they're the comparison group in this study. So they had this parent program, the 2 sessions with the researchers where the parents had to come in, but then they also had weekly feedback and homework assignments that went home with the children, so things that the parents could work on at home. So they had the tutoring sessions and then some in-home maintenance of the skills. And so what they did is they assessed children on their math performance and a number of other behaviors before and after the 6-week intervention to see if they could measure some change in their math skills. So what did they find? They found very positive results. The program definitely worked in improving math. The children in the MILE intervention group had much more improvements in math than those in the contrast group that were just getting some general educational strategies. And they were more likely to have clinically significant gains in math of over 1 standard deviation increase. So that's actually a very big increase to see over a 6-week period. So it was very effective. The results were very, very positive. Interestingly, parents, so in order to measure their behaviors, that's usually done by parent report. And what they found is parents of children in both groups reported improvements in their behaviors. So even those in the control group that were still getting some individual education plan and where the parents were still going to those workshops, they still were seeing some improvements in their child's behavior. So behaviorally, we did see improvements in both groups, but the math group was specifically targeted on improving performance on math in the math group. Fortunately, they also followed them up 6 months later. So they had the 6-week intervention and then they did not have any more individual math tutoring. And still, when they went and contacted them 6 months later, the math group still had maintained a lot of their improvements in math and still had significantly higher math scores than the control group. So, and they both still also showed the improvements in behavior. So this is exactly what we want to see. This is fantastic. We can improve math and we can maintain those problems 6 months later. Now, I think that they are still doing some further follow-up and hopefully these math skills are still, these improvements are still being maintained. But of course, there probably is going to have to be some other work to work on maintaining these skills over time. It's not just like a 6-week intervention is going to be a one-fix solution. You're going to want to work on these skills over time. But remember, the parents were taught on how to help working on these skills at home as well. So when I read this study, and I do know Claire Coles, who is the developer of the program, because she was actually on my PhD committee when I did my PhD at U of A a number of years ago. I contacted Claire and I just said, this is a great program. I'm very interested in math and FASD and I want to do your program here in Alberta. And she said, great, let's do it. We just need some money. So what we did is we applied to the Alberta Centre for Child, Family and Community Research for a grant to do this study in Alberta, and we were successful in getting the grant. This is conducted in collaboration with Claire Coles and Julie Kable from Atlanta, who developed the program, as well as Jackie Pye here in Edmonton, Gail Andrew, myself, and a graduate student, Katrina Cully-Martins. And then we also have a couple other team members involved in policy and whatnot. Anyways, so, okay. So we've been partnering with them for about, about a year ago. We initially sat down at a table at the last international conference on FASD in Vancouver, and we said, okay, let's do this program in Alberta. This is a fantastic program. And in a year, we've received a grant and we're now just about to start the program. So we're very, very excited about it. We will be conducting it in Edmonton just because that's where our research team is and that's where we have the grants. It'll be conducted in collaboration with the Glenrose Hospital FASD clinic. So like I said, Gail Andrew is an investigator. So we'll be recruiting children who have been diagnosed with FASD through the FASD clinic or through their preschool assessment clinic, because remember, this is a program that's targeted at younger children with FASD, and also through local school boards. So we're recruiting through the school system. So we're not just replicating, well, we're replicating the program, but we're making some key changes to the project as well, because we didn't want it just to be a standard replication. We wanted to look at ways that we could work with the team to possibly improve the project here in Edmonton and do some extension of the project. So some things that we're doing is, one key thing is I really didn't want to have a control group that received nothing, or, well, in their case, they received an individual education plan, but I wanted their control group to receive something more. I really didn't want to take all these children with FASD and randomly assign half of them to be the lucky ones that get the math intervention and the other half that don't get much. It didn't sit well with me, so I wanted to do something more for the control group. So what we decided is, why don't we give the control group another intervention that has nothing to do with math, so at least they're getting something that still would be important, and then we can actually measure whether or not that other intervention works, and we can compare it to the math. So we tried to choose something that was so different from math that there would be no overlap, but that was still an area of need in kids with FASD. And so we chose social skills, because we know that social skills is a very significant area of impairment in children with FASD, and there's very little overlap between social skills and math. Had we chosen, okay, let's do an executive functioning intervention and a math intervention, there's a lot of overlap that we probably would not have found very good results. Well, we don't know. We haven't started the program yet anyways. But so what we've done is we've decided we don't have a control group. Our comparison group is the social skills intervention. They're going to receive one-on-one social skills training with the trained researcher. And then the math group is going to receive the one-on-one math intervention, the MILE program. And then this way, we can really measure the effectiveness of both programs, and we don't have this control group that doesn't get anything. We also are looking at a number of other pre and post measures in addition to what Claire Coles and her group use. So we're looking at some other different math skills and looking at a wider variety of math skills. In Claire's group, they mainly looked at whether or not the program improved math, but remember the program is also focused on improving visual spatial abilities and memory and these other skills. So we wanted to measure other cognitive areas besides math to see whether or not this intervention also can improve those areas, because those skills are actually targeted in the intervention. So we just have a broader range of skills that we're measuring pre and post intervention. We're going to do about the same 6-week intervention. It's going to be 10 sessions, I believe is what we finally decided on. One-on-one, about an hour and a half, conducted one-on-one with a trained researcher. And we're going to do it in the school. And the main reason for this is I just felt that to have the parents have to bring their child in over a 6-week period 10 times into the Glen Rose Hospital, pay for parking, do all this stuff, it's such a headache for them, and it's just not as feasible. It's hard enough, to get people to come in for one study, and I mean, people are very great and they do, but have them come in 10 sessions over 6 weeks. We thought, why don't we go to the schools? We can take the child out of a class that it's okay that they can miss and do the intervention there in the school. There's much less work on the parent. It saves people time and money, and we can always get the child when they're there at school. So that's what we're going to do for the most part. If there are some parents that would prefer to bring their child in, then we would accommodate to that. But I think for the most part, it will be conducted in the schools. And we've done this with previous research. It works out quite well. There's always some sort of quiet room in a school, usually, that is not being used, that you can take a child to work with, whether or not it's an office or a gym or wherever, a corner of the library. Another thing we're going to do is we're going to reduce the parent component, and people may think, why would you do that? Well, we actually want to be more confident that it's actually the math intervention that is leading to the improvements, not just the parent component. We still are going to do the workshop with the parents, the overall workshop, and on FASD, and some general educational workshops with the parents, but we're not going to have as much of the weekly feedback and homework assignments for the parents to do at home, because we just want to see, first of all, is it just the intervention that's working, or was it just the parent component that was working in the first project? So we're going to reduce that And hopefully we still find the intervention to be effective, because then we can look at other ways that this intervention can be applied across the board and in different school systems. Of course, the parent component is important, but we also just don't have the time to do that, because we're not actually going to be seeing the parents every week. We're going to be seeing the children every week. So we'll reduce that a bit, but still really focus on the individual tutoring or the individual social skills sessions. We've changed the sample a little bit. We're going to work with children aged 5 to 10. Claire's group worked with aged 3 to 10, but they found that it was mostly effective for those 5 and older. And here in Alberta, we don't have a lot of children that are diagnosed under age 5, so we thought let's stick with age 5 to 10 and hopefully have a sample that we are going to see some good improvements. Another important difference is just not a difference that we created, but a difference that just relates to geography, is that our samples are very, very different. So the sample in Claire Cole's study in Atlanta is a very different demographic and a very different population than the samples that we're dealing with here in Edmonton, Alberta. So again, we can look at whether or not the program works for different groups of children, different SESs, ethnicities and whatnot, just a different demographically group of children. Okay. So we are recruiting for this study. We're just about to start it. We're hoping to run phase 1 of the interventions between now and June, and then we probably will have a phase 2 running again in the fall, because I don't think we'll get all children in before the school term is up this year. We're looking for 60 children, because we would like to have 30 children per group, so we have enough children per group to measure changes. So it's a pretty large undertaking. Like I said, I have a graduate student, Katrina Cully-Martins, who this project, part of it will actually be her thesis for her master's. So please contact me if you're interested in the project. And again, I mean, I know it sounds very exciting, but right now we only have the feasibility to conduct it within the Edmonton area, because we do have to travel to the schools and we have to coordinate everything. And we are looking for children that do have a diagnosis of an FASD. And again, we also have to get permission from the school boards that the child goes to in order to do the testing in the school. And there's lots of different hoops to jump through, but it hopefully will work out great. So if you are interested, if you do have a child that would potentially be eligible, or if you're just interested in finding out more about the project and the program, please contact me. This is the first step for this project. We're going to conduct the intervention, and then we're going to look at ways that we can extend it. So hopefully, based on the results, because remember, this is focused more specifically on the tutoring, we're really hoping, if it is effective, which we think it will be, that we can look at ways that a lot of these skills can be applied in classrooms with children with FASD, that the teachers can be doing and whatnot. Because like Jackie said, it's great to have these amazing interventions, but if it takes so much time and money, it's not going to work for everybody, and everybody may not be eligible for this specific research study. So after this, we really want to work with the school board and look at ways that we can extend this into classrooms, and that will hopefully lead to really another study that we'll conduct next, where we actually look at teachers implementing some of these strategies. So we're very excited about this study. I hope you guys can see my excitement. Very excited that Claire Coles and her group have partnered with us on this, and that they've developed such a wonderful program, and just feel very fortunate that we're able to implement it here in Alberta, and very, very fortunate to ACCFCR for providing funding to conduct it. So that's where we're at, and like I said last time with all the other presentations, hopefully we'll be should be back in a year to present on the results of this program, because we'll have them by the fall. So very excited. So I'm going to turn it over to Jackie now. She's going to talk a little bit more general about some of the strategies for improving math in this program, and general strategies as well. So thanks, Jackie.
Thank you, Carmen. That's exciting. I'm so excited. Even listening to you, Carmen, I got all excited again. I'm just thinking about it. And as Carmen said, it's the first step, or actually it's not even a first step anymore. We're kind of in a mid-step, because Claire and Julie took the first steps in establishing this and setting it up. And now we're getting to kind of apply it and look more towards how we can make it meaningfully effective. So if you think even of that early model that I talked about in terms of how we do intervention research, I mean, Claire and Julie used it in a lab, and they set it up, and they said, yeah, look at the changes we're seeing. And they're amazing. I mean, Carmen is right. Like they're getting really strong intervention results, stronger than we often see. Like they're really quite noteworthy. And so now we're saying, okay, well, let's take it into a school. Let's get a little step closer to how we can, make this something that's part of the real world, so to speak. And then, as she indicated, after this, we want to even go a step further and say, well, how can we extricate ourselves so you don't have any researchers involved and the school can do it entirely on its own? Because that's the progression that we like to take towards equipping people to make this a useful intervention and to see these kinds of results. But that's a process, right? And Carmen said, it's going to be a year before you hear how this works, which means it's going to be another year or two before we look at how we can actually move something like this effectively into a school. So you're going, well, lovely, Jackie, and you guys are all excited, and that's thrilling, and we might get some kids involved in it, and that's great, but what about all the rest of the kids, and what do we do in the meantime? We need something tomorrow, not 3 years from now. And so what we'll do is we'll talk a little bit now about some of the strategies and some of the approaches that have been employed that might be just little tips and ideas that you can take with you into the classroom tomorrow, today, or into your home environment and get them working right away. First thing I will just speak to very briefly, and Carmen talked about this already, but when we're talking about math, I think, as Carmen said, we often think of addition and subtraction and calculus and those things that used to give us nightmares, or certainly still give me nightmares. But there is a lot of functional implications. And when we think about math, and when we're thinking about math with this intervention program, what we're talking about, but just in terms of life, like what's the point? Why do we care? There are a lot of basic functional aspects of math that go into daily living. I mean, some of it is things like budgeting and money management. We can usually end at that one. People are fairly familiar, and we do think again of addition and subtraction and what do I need. Although, as kids get older, budgeting and money management becomes very, very complex as we start to think about things like interest rates and what do I buy and how much is this really going to cost me and all of these payments. I mean, we actually have fairly heavy expectations on all of us in terms of day-to-day math. So as we look into adulthood, there's a fairly heavy load in budgeting and money management around more traditional ideas of math. But what else? What else? Well, applied work. A lot of times with kids with an FASD, we're saying, let's look at applied streams. And we talk a lot about vocational programming and training in that direction. But let's think about that for a minute. Construction work. Okay, you go into the construction, go into the trades, use your hands. That's great. Great idea. Okay, what's construction? Measurement, angles, how things fit together. How many supplies do I need to buy in order to build this? So how many pieces of plywood am I going to need to cover this wall? Well, I need to do measurement. I need to figure that out. That's a lot of math. That's visual spatial skills. I have to have a certain degree of working memory so that I can actually hold things in my head while I'm manipulating that visual construction. Those applied things that we're kind of moving a lot of our kids towards have a lot of math in them. Even if we look at things like electrical, somebody's doing electrical wiring or something, math, how much wiring do I need? How many boxes do I need to put in? You're hard pressed to look at the trades and not see some element of math involved, whether it be measurement or visual spatial skills, those aspects. Cooking, basics of cooking, lots of math there. Anyone looking at a cookbook lately? I do as rarely as possible. I'm not a good cook. I'm a terrible cook. And it's probably because I'm just so bad at fractions. But wow, there's a lot of math. How do I cook? How do I feed myself? Short of putting the craft dinner in the pot, if I want to do a little bit more than that, there's a lot of math involved. Greater than and less than. All these basic ideas. Carmen talked about how, math really is emerging with our youngins, like at 3, 4, 5 years old. Well, what are the basic foundational elements of math that they're getting? Greater than and less than, more than, bigger than. These are big ideas that extend into a lot of what we do in our day-to-day functioning. Even if we're weighing pros and cons of decision making, we're kind of thinking greater than and less than relationships. If we don't really understand how to differentiate between greater than and less than and what that really means on a basic conceptual level, we're going to have trouble with all of that. Pattern recognition. Even how do I recognize pattern? That comes down to some basic visual spatial skills. How do I recognize a pattern? A pattern can be in facial expressions, a pattern can be in how a room is laid out, a pattern can be reading a blueprint for that construction we were talking about earlier. Patterns can come out in a lot of different places. If you think about your own jobs and your lives, you think, well, when do I need pattern recognition? Even things like reading a map and spatial relationships. I don't have on here, I mean, I could go on and on. We could talk about math all day and how we use it in our day-to-day. Distances, near to and far from. How long will it take me to get somewhere? Telling the time, calculating time. How am I going to be on time to an appointment if I don't realize that it's going to take me half an hour to get there instead of 45 minutes because I have to calculate time and distance and have an awareness of that? We do these things all the time. You look at your watch and you say it's 8:15, I got to be there by 9, it takes me about this long to drive there. That's all math. If I can't do that math, I'm going to be late or so early that I end up wandering around to do something else to burn off time, and then I'm late in the end again. So prediction, how I do prediction, how I anticipate what's to come. Math is all about prediction and how we start to estimate and establish what might come next. This is math. Some of it is math as we think about it in plus and minus terms, but some of it is more of these core conceptual pieces that Carmen was talking about earlier on. And so I speak to this just because I think that when we talk about math, we're not talking simply about the academic component of math where we're sitting in a classroom doing addition and subtraction. We're talking about math as it permeates so much of our life, which might be why when we look at math, when we see the impacts on math, and part of the study that Carmen was talking about that we're doing here in Edmonton, we're actually extending our measurement to look at the other areas that this math intervention is touching on, because we want to see how this intervention permeates in a bigger way. When we see these behavioral changes as a result of the math intervention, are we seeing the behavioral changes because the frustration is coming down, or are we seeing behavioral changes because some of these basic conceptual skills are improving, and so the ability of the kids to negotiate day-to-day living is improved? So what is it? Is it a frustration decline, or is it an increase in other skills, or a bit of both? These are questions that we have that are really interesting, particularly when you understand that, boy, math is big. All right, so that just kind of grounds us in importance. And now I'm going to talk through some of the strategies. And none of these are rocket science. And a lot of these are things that you're going to be very, very familiar with. And a lot of times you're going to go, oh, yes, of course, Jackie, we do these things. But these are key things that have come out of some of the work that has been done and some of the tips that we can always extend into what we're doing. Some of the ideas around strategy relate to organization. So Carmen explained a little bit about that central executive and how there's that part of our brain in terms of memory and math that allows us to mentally manipulate information. That same part of our brain is what helps us to organize information. And so if you're having difficulty with organization and how you organize what comes first, what comes next, this is going to impact your ability to do math. And this is one of the things that we work on. And so really thinking about the organizational skills of the kids that we're working with. Teaching organizational skills, never assuming. Assume nothing. Teach the basics of organization. Refresh those basics. Repeat those basics. Check out how that binder is organized. How are those pages laid out on a desk? What does the desk look like inside? If you dare to go there. I don't even look in my kids' desks anymore because it frightens me. But with kids with an FASD, the level of organization becomes even more crucial. They can't get away with as much. And so we need to support some of those organization skills. And so being a bit more intentional, creating reminders and systems, binders with really colorful tabs in them that help them separate things so that color can link to topic, those kinds of ideas. And those of you teachers who are listening, I suspect you could step in here and say more about organizational skills than I could ever imagine. But what's working? And this is, again, where practice information can really inform us. Think about what is working and what's effective with organizational skills, and then be intentional about teaching those and repeating those with kids. This will be really crucial. routines and systems to maintain that organization. So once you find a system that works, how will you be maintaining it? How do you continue to support it? And doing so in a proactive way. These guys will have trouble maintaining the system on their own. So we need to be proactive as opposed to saying, oh, man, we just sorted your binder out a day ago and now it's a mess again. What are you doing? And we might feel that, but we want to be careful that we're proactive with the kids. Oh, okay, yeah, looks like the binder's out of order again. Okay, let's go back and do it again. Okay, let's go back and do it again. Okay, let's go back and do it again. More proactive as opposed to waiting till we have a problem. Homework monitoring, homework books, agendas. We see a lot of those going home right now with kids. Those are great approaches, and a lot of times that happens. How do we monitor those? How do we communicate with families and caregivers to monitor those as best as we can where we're able to? Basic strategies around organization, really important. It applies to all of learning, but in particular we're talking about math, but it applies to all of learning. So we get the organization in line. Okay, that's important because if we're not organized, we're not going to get anywhere. Now we're talking about memory, and Carmen, explained to us a lot about the importance of working memory when we're dealing with math. So what does that mean for strategies that we can use? Well, and we talked about some of these things already when we did our memory session. And so these aren't necessarily new, but we'll go back over them. But smaller chunks of information, little bits, smaller information punctuated with little breaks and gaps will get us further than trying to do more. Less is more kind of message. Smaller chunks that we can repeat over and over again. Presenting facts to music or using rhythm. This is one of the things they do a bit in the MILE program as well, is looking at how rhythms can be applied to look at things, how music can be implemented, keeping in mind that music and rhythm are mathematical, right? Music and rhythm are mathematical. So when we're doing beats and rhythms, we can work to that, and we can talk about how 4 beats can go into one whole note. And when you practice that and you play with that and you do it in a physical way, that communicates as a different way of communicating those parts to whole, or fractions that it later becomes. So how can we incorporate music and rhythm into the understanding and the memory? And it gives us another way for learning. And when we can engage kids with their physical bodies, it's another way that memory can take place. So the more the kids are physically engaged, so, if you've got little sticks or tambourines or things that you can, yes, I know that would be loud, and I already know I can hear your headache coming on as you think about a classroom full of people banging tambourines. But looking at math and even greater and less than, when we look at louder and quieter, what makes that greater? It's louder. Well, what is that? We're looking at kind of relationships between things, using music and using sound. And if they're using their bodies, this is going to have more meaning and more retention than if we're just talking. Talk. What I'm doing right now, not all that memorable. So, well, people now are laughing, yeah. But it's not. It's really not. I mean, what's better is if we all got up right now and started to do the math dance, and we create the math dance, That's going to mean a lot more, and that's going to hold a lot more for kids, for all of us. When you leave today, if I sat up here and started to do my interpretive math dance, it'd probably be the only thing you remember from today, for a lot of reasons. But employing those approaches to math is really effective. Cues and scaffolding, the more we can use, we know with scaffolding what we're talking about is sort of helping kids approximate the correct answer until they get there. And using cues to help with that. One of the things the MILE intervention has done, which is great around cues, is they really approximate and they work with the kids, and they talk about near and far cueing. So they talk about starting out with far kind of supports. It's called sort of a far strategy, where you start with saying, well, what is it? What do you need to do on this? What is it asking you to do? So you start with sort of the furthest from the task, which is understanding what the task is. What do the instructions say? What do I need to do? I need to add the, I'm going to go with basic math because it's easiest for the example, but I need to add these numbers on the page. Okay, so what does that mean? It means I have to say how they go together. Okay, so what's the first one? 4 plus 4. And what does that mean? Or what do you think you need to do now? Well, 4 plus 4, and I have to put them together, and I have to add them. Okay, so what would that be? And so as you start with the instructions, you're at far prompting and you're moving and you're sort of cueing it and scaffolding it closer to closer. And you may find kids get very quickly then, oh, I have to add them together, 4 plus 4, 8. Okay, great job. Or they may go, all right, let's read the problem together. What does it say? 4, what's that symbol mean again? I don't remember. So what are we going to do? We're going to do a close prompt, which is a form of cueing. So instead of saying plus and giving it to them, I'm going to go pull until they get plus. You got it. Good job. Their success. But I've cued it, I've prompted, I've taken them as close as I need to in order to help them get the answer. So let's say it again. 4 plus 4. So what's 4 plus 4? 4 plus 4, and maybe we have manipulatives, and I'll show you some, and they're adding it. 4 plus, it's, and I might go and they go, 8. And I go, yes, 8, you got it, good job. And we keep going like that and move ourselves back over time. But that would be a scaffolding and acute approach that takes you from far prompting, do you know the instructions, up to close prompting, where I may even be giving them the first few letters, 8 or pl, and then letting them finish it. Especially with the youngins, this is going to give them way more opportunity for success. And I mean, when we're talking about those approaches, we often are talking about the youngins. Repetition, practice, overlearning. Crucial. Over and over and over and over and over again. We talk about that all the time. And when they come back the next day and they don't know what they're doing, it's all right. It's not that they don't care. It's not that they're just trying to drive you a little bit batty. They really do need that overlearning. They need to hear it again and hear it again. Don't be surprised. Don't be surprised when they don't need it. Sit down and work with them again, or support them again as best you can, or put those supports in place as best you can. I recognize the time load on that, and I recognize that you're dealing with, large groups of kids, but knowing that there may be this real need for overlearning. They'll have it 5 days in a row, and then the 6th they don't have it anymore. So we go back and we do it again, and then proceed that way. And over time we will see growth and advancement, but it will just take more time. It'll be more of this kind of journey that gradually takes us up, but it's still going to be ups and downs and ups and downs. Give time for recall and remembering, sort of a 10-second rule. And I mean, maybe you'll know your kids better, you'll know what they need. Carmen talked about processing speed and the fact that we need to understand that sometimes these things are simply going to take longer. And the more pressure we put on kids to respond quickly, okay, well, how good do we all do under pressure? If somebody's standing over you saying, come on, tell me, it's like, it doesn't come. These kids process information a little more slowly. We need to give them the time. So if we're going to ask them a question, if you're asking kids to do something on a board or in front of a classroom, prep them ahead of time, give them warning. Say, okay, we're going to do these 4 questions, and Johnny, you're going to do this one, and Sam, you're going to do this one, and whatever. So we'll start with this person, and we'll do this one last, so that they've had a little bit of time to know what their question is going to be. Then they have time to prep it, to think about it, to ponder it, so that they're not all of a sudden stuck with it and unable to work quickly. Metacognition. This is thinking about thinking. And how do we teach kids thinking skills? And this applies to math as well. How do we think about what we're doing? This is where we look at questioning kids around how they did things. Get them to explain to us. Explain where you went. Whether it's the right or the wrong answer that they generated, we want to know how they got where they got. And sometimes even in the explanation of how, they might figure out, oh, wait a minute, I went this, and maybe I should have done this way. We want to engage them in a process of thinking about how they're thinking, because they're not going to do it automatically. We generally find they're going to kind of jump into something, and they may not even be aware of their own processes that took them from A to Z. Great answer. Doesn't matter if it's right or wrong. I didn't say right or wrong. I said great answer. How did you do that? Tell me about it. Show me what you did. What strategy did you use? Okay, let's see if that works. Let's try it again. Let's do it together. What do you think you need to do here? What do you think needs to happen? So there's some prompting in here, but there's also eliciting that thought process. What makes you say that? How did you get there? So really trying to figure out, because the more we can understand about the thinking that they're engaging in to get there, the more we can say, oh, okay, what if we tweak this? Or, oh, here's where things need to go in a slightly different direction, or here's where the misunderstanding is. But it also can engage those kids and helps them to practice asking themselves these same questions. Practice saying, wait a minute, how did I get here? How am I doing this? What is my process? What's happening? Because these are questions we want these kids asking themselves eventually. This is the kind of stuff that we do often when we're sort of checking our own things, thinking about our own work, monitoring our own process. We do these automatically. We need to work with the kids to help train these and support the development of these. And so we practice it and we practice it and we practice it. Helps us identify where there's problems, but it also helps equip the kids to be thinking about what they're thinking about. Visual spatial skills, another area. Again, you'll notice that these are very parallel to what Carmen talked about in terms of those underlying issues. What do we do to support visual spatial? Because math is a large amount of visual spatial. I mean, when we talk about things like geometry, okay, we can all agree that triangles, squares, yes, there's visual spatial, but it's everywhere. Even if we're doing addition, 2 digits over 2 digits, there's huge visual spatial there. I got to think of first how I line things up over top of each other, and then when I carry things down, it's all visual spatial and where placement is. So how can we support these? Manipulatives, hands-on, things that they can use. Talk about objects. What does it look like? Let's think about this. Let's accompany, and this is where Carmen talked about pairing the verbal and the visual as much as we can, bringing things together, spending more time to suss it out. Establishing a solid left, right, up, down pattern. So what is left and right? What is up and down? What does that mean? Assumptions that we make, and I'm going to show you a couple of things after this that help to do that. I've got a couple pictures on, or just the pictures on here. Guide visual attention. So really show a lot of guidance. So instead of just sort of pointing at the question on the board, if we're looking, or the smart board is now is the case. I keep wanting to say chalkboard, but I guess that really dates me. The smart board, we want to make sure we're actually working item by item. So it's really pointing directly at those numbers, directly at where we're at. Verbally focused attention. So look at this. And again, we're just accompanying the visual with the verbal, nonstop, really partnering those two. And some of these you'll recognize also as attentional strategies that overlay as well. Add structure to paper. Raised lines and graph paper really can make a difference. For some, I've seen some kids where they go and they use graph paper and they use it for all their writing. They're not just math, all of their writing, because it gives you the up and down and the sideways lines. Huge improvement. Huge improvement, because just the single line along the base was not enough to help them guide and track. So using graph paper for some of the kids, even for writing and beyond math, is when they would print and things, they would even just print a letter per square. Really helped, and then leave a space between words. Just help them at first to get some of the structure and to separate things so that their writing became a little bit more legible. Same deal with math. If you've got graph paper, a lot easier to line up 22 minus 11 and know that the numbers are lined up perfectly because you've got the boxes around each number to support that. So huge difference. Graph paper in and of itself can be one of those just little things that you can use, start using tomorrow, that can have an impact. One of the things too that was used, it's a resource, and the MILE program used it, it's called Handwriting Without Tears. It's sort of a little bit of a program that helps to support basic graphomotor skill. And they found some really nice success in that MILE program where they saw that kids went from really having difficulty to having much more success with that graphomotor control, which is important to math. If you're not forming letters well when you're printing them, then, or pardon me, you're not forming numbers. It's good I'm doing math with letters. Well, I guess, you know, I'm in advanced math. But if you're not forming your letters well, your numbers well, you're not going to be able to do the problem. You're going to not even know what you've written down. You're going to write down the wrong number. You're not going to be able to read, or somebody else who's grading your work isn't going to know. So there is something to be said for being able to get that down. So let me show you a couple. So this is, and this is in your handout, some of the pieces that are really important. You see the graph paper. You see how the graph paper allows for that lining up of the numbers. The number line. Really, you know, this is just a smart little things that these guys have done, is taking the number line and running it always up and down. So a lot of times we use number lines that are side to side, but they don't make intuitive sense. If you don't understand that moving to the right means greater, it doesn't necessarily make sense. It's a teaching, right? We teach kids that, but there's no intuitive meaning in that. Whereas going from the bottom up, higher, gets bigger. We kind of get that because that's how we all work, right? So running your number line from lower to, so having the kids have number lines that go up and down in itself can help them use a number line far more easily than a number line that goes side to side. So putting number lines in your classroom that are up and down, having a number line on these kids' desks that starts with 1 at the bottom and 20 or whatever at the top, right there is going to be a little bit more intuitive and make more sense to them. Because if it's right to left, they're going to keep forgetting which direction they're going in. Which one is bigger again? I don't remember. Up and down? Okay, yeah, I get that. All right. Manipulatives, you see some bingo chips, little things like that, just stuff that they can hold in the hands. In classrooms, I know, these are available. Really pairing and pointing at and making sure that they're directing. You see a little moving? Huh, look at that. Anyway, sorry. But really making sure that when we're pointing at stuff that we're directly pointing. So again, a lot of times, like even what I'm doing right now, terrible. No, don't do what I'm doing, but it's because I'm standing over here and I'm talking to you. But I'm pointing at a board in a very general way. What you need to be doing is getting right next to it and pointing directly at that topic and making sure that your fingers are connecting with that which you are pointing at and speaking to. So that connection is made very, very directly. Don't sort of, when we do these general things that I'm doing right now, where we point in the area, or we say, look over here, we might read the numbers, but we're not actually connecting our finger, our hand to those numbers. It's too far. We're expecting too much of those visual spatial skills and that picking up of the language. We want to pair our language with what we're doing physically, which actually means I need to have my hand or my stick or whatever right on that board while I'm talking about those numbers to support that. Don't expect that they're going to find it on their own on that board. Even if they say, you're saying 22 minus 11, and it's right up there and you go 22 minus 11 and you're pointing at it, they're going to have trouble seeing it until you actually write 22, 11. This is what we're doing so that we're really orienting what they're looking at. And none of these strategies are bad for anyone, right? So even when we're thinking about what are things that you can use in your classroom, these are great strategies. These are not strategies that require singling out a child. Any of them, really, that we're talking about. Classroom environment. No rocket science here, and once again, I suspect that there are a lot of individuals listening right now who could add to this list and do better than I am. But things that are important, predictable class routines, knowing what's coming. A lot of teachers I see now, they do wonderful jobs of visual routines on the board. They have a list on the board, timetables on the board, things like that that are always visible to the kids. Some individuals will use little clocks that like a little visual timer thing that will show people as they're approaching the end of the class period to help establish your class routine so that you always know as the little bar is approaching the red zone. Once you're in the red zone, it's time to start thinking about cleaning up materials and moving on to the next. Seated close to teacher. We all know that helps to promote attention to some degree depending on where the teacher's sitting and whether or not she or he is ever at their desk. Positive peer models, looking at positive peer models, a lot of times we do find that when kids with an FASD are partnered with a positive peer, that can have some good impact for that individual. Seated away from distractions. Clearly stated rules and expectations, again, having them posted in the classroom and not just posted verbally, but having some visual accompaniments are usually helpful. And we already talked about organizational support, homework, schedules. Couple of key, just general messages. Children with an FASD may learn differently or slower than typical children, but they can and will learn. And so as we set goals, we're setting goals towards success. And know that we can have success. It's about finding the right goal for the children we're working with. We find the right goal, we find the right system of support for them, and we can see learning. It just may not be the same as anyone else. Sometimes challenging to find out the best way because all children are different. There's no standard. We've talked about that before, which is again why practice-based evidence is crucial. There is no standard right now. There is no single way of doing things. There are a lot of different things and one thing will work brilliantly with one child and not so much with another. So sometimes what we need is a bit of a repertoire. We need some selection so that we can try something and when it fails we go, ooh, that didn't work, and I know it failed because I'm monitoring and I'm measuring and I'm keeping track of what's working and not because I know what my outcomes are. Well, that didn't work at all. Whoa, and I mean, that happens. But I can try this because I can pull out my next idea, and here it goes. Or I can go into the staff room, or I can go and talk to other parent groups, say, oh, what else can I try? And I can try these different things. There is no standard, but we have some ideas. Other resources too, and because I've talked about a few, but just to kind of point for those who may not be familiar, Do to Learn has a bunch of different resources available on this website that can be valuable. So it's a website that you may want to take a look at if you're just looking for the kinds of materials that you can print off and use to help support some of these strategies. Or others. I mean, and I know that there are many materials out there, but this is one site in particular, and I know that in Atlanta with the MILE program, this is one of the sites that they have used most and found most effective and helpful. So something worth checking out. Finally, and I've said this before, but I'm going to say it again, we're still learning. We don't have the answer. We're really excited about some things, and as Carmen talked about some of the exciting things that we're involved in right now, we get really excited. But we are still learning. We're still trying to figure out what works best, and how to make it effective in a day-to-day way, in a sustainable way. We're still thinking, how do we do a good job of taking what we're doing at research level and making it into something that's sustainable day-to-day, in a functional way? How do we take what you're doing in a day-to-day way and create an evidence base to it so that we can promote it and talk about it and make sure that we can extend from that? How do we move this information? How do we communicate this information? How do we help to improve our practice, informed both by existing practice and research? These are still questions we have, and these are things that we would love to hear from you guys on as well. What can we do to continue to improve our systems of communication and support so that information around strategies and interventions can keep growing and developing? Well, some of the things that we can do, we know, are staying informed, going to conferences, talking to each other through kind of webinars and these sort of opportunities. These are some of the things that we try to do to figure out, okay, now what do I do? Looking at partnerships. How do we create partnerships? How do we talk to one another? How do we contact each other? Well, our contact information is here, but how do we sort of build our capacity in that way? Asking questions, never to be satisfied by the status quo. I think questions are great. Is how do we do this? What would this look like? How do I know this is working? How do I, make this happen in my community, in my school, in my home? Asking questions. See the potential, knowing that we can have positive impact. We can be optimistic. We can see potential in the children that we work with, in the schools we work with, in the programs that we're pursuing. Because otherwise, if we don't believe that, it's pretty easy to get discouraged very quickly. Other things we can do, I've got up here, and it's an old newsletter, but we have the Canada Research Network. And it's no longer Northwest, so this says Northwest, but it's actually Canada now because it is now national, is one way to try to stay connected to what's going on and to think about what resources or what is available to me. We're still figuring out how to network people, and we're always interested in what people have to say. If you check out the Canada Research Network page, Canada Research Network page, my words are starting to jump around today. You'll find that you can connect with our intervention work. You can also email me. We have a quarterly electronic newsletter that we email out. So if you're interested in receiving that newsletter, we always invite contributions to that newsletter. If you're doing something, if there's something you want people to hear about, if you want to connect with people, you can always put a contribution in the newsletter. It says, hey, I'm doing something really cool. Anyone else doing something like that? These are some of the opportunities we like to create through this newsletter to connect people. We also have a blog site where we try to post new and interesting things that are going on, intervention things. There's an opportunity for comments and communication through that, so people may connect through that. There's also a community of practice website now, and I've talked about it in our last session, that exists through University of Lethbridge has set it up. And again, it's a website where they're trying to create some groups and communities for information exchange. How can we network people? How can we get people talking? I often hear from teachers, I just want to hear more of what other people are doing. I want to have more ideas. I want to be better connected. So what can we do? Well, we've got the blog. We're trying to get the electronic newsletter. We're trying to make ourselves available. Email us. We can try to help out. And we have that community of practice that's available. So seek out these opportunities. I encourage you to do so as ways to connect ourselves and think about how we can move information in a more effective way. And that's it. And now questions, if there are questions.
Sure. First, I want to just mention to everyone that we've noticed and have had some people letting us know that the handout posted online is missing some of the slides. Not your fault, Jackie. You don't have
Oh,
to
I'm like,
look
ooh.
confused. No, it somehow when we created the document, there was an error and we didn't catch it. So we will repost those.
Oh, great.
Just so people can check in the next few days, and they'll be reposted.
Good. Thank you.
Yeah. One question we have is, Lindsay is wondering if you know of any studies regarding math, early math skills for adults with FASD in the adult learning population. She mentions that a lot of the strategies we've talked about today will be useful with an adult FASD population. And some of them are maybe too child-directed for adults. So she's wondering if there's any additional resources that might help out her team. She's with a counseling and specialized supports team.
Yeah, that's a great question. And I don't know of any. And I mean, unfortunately, yes, a lot of the math stuff that we know is directed to the younger, particularly elementary ages. I'm looking at Carmen as I'm talking. I think that, yes, some of these approaches could be useful. I mean, even things like the graph paper stuff. But in terms of the intervention approaches, I mean, we're talking about classrooms. We're looking more, and particularly elementary level classrooms. Mm-hmm. Carmen, do you know of anything with adults?
I don't. I'm sure there's stuff out there with other populations, adults with math disabilities and whatnot, but I don't know of anything specific to FASD. But if you look at the math disability research and information out there on the web, there probably would be some stuff that would apply.
And if anyone has things that they've done with adults that are useful, that would be a great source of some conversation. Again, talking about how to communicate, what works, it would be great.
I'm wondering if the family literacy programs might have some strategies for adults, because they work a great deal with adults who are developing their literacy skills, and it may extend to mathematical literacy as well.
That's a great point.
Yeah.
Can you repeat that in case?
Sorry. Yeah, Jean was making a great comment that it might be worthwhile checking out some of the literacy groups, because there are a number of different literacy groups in different communities that help adults with reading skills. But perhaps that they would also have some information about resources that would support math as well. I think that's a great idea, because there is certainly far more supports for adults around literacy, and in terms of formalized supports for adults around math, you don't see that. I mean, you see lots of literacy groups, and there certainly are, but sadly, particularly given what we've just said about math, there aren't as many. Now, I'll add one other thought in too, is to keeping in mind that we are also talking about a number of other skills. So we have talked previously about memory skills and things we can do about memory. We've talked about metacognitive skills. Those are things that do extend easily to adults. So when you're working with adults, asking them how they're getting things, how they're figuring things out, what they're doing to solve problems, that's very appropriate. And we can certainly language it, appropriate to their issue. But employing those kinds of metacognitive skills and problem-solving skills with adults would be really an appropriate direction to go in. And that may also have an impact. So, great.
I have a question. It's for Dr. Rasmussen. When I was teaching, when I wanted my students who had significant sensory disabilities to learn a math concept, I quickly learned that it was very successful to use the strategy you described of building in a motor component. So I'm dating myself, but at that time it was important to read a face clock. So you had to know 5, 10, 15, 20. So we would do every time a 5 is at the end, you sit down, and when a 0 is at the end, you stand up, and they would learn it. And I was interested in what you said. I never made the connection before about the parietal lobe and learning math. Is that why the motor connection is significant there?
It could be. I mean, that sounds like a great theory to test. It definitely could be. I mean, in a lot of this research, when you pair one domain with another domain, it seems to help. Like we're talking about pairing the visual with the verbal, but here just pairing it with something more motor. It definitely could be, because those skills are also related. So
certainly.
Yeah.
Well, and physical learning, like learning by movement too, is more of a procedural learning, which is housed in our cerebellum. So that it's a different, the cerebellum gets quite active in our physical and our motor memories. And our motor memories do link to our parietal, which gives us a lot more of that visual spatial learning, because in our motor learning, like learning to play tennis or something like that, which comes back here a fair bit, is incorporating a lot of the visual spatial. But as Carmen said, even just the idea of getting information in through different domains in and of itself, regardless of the specific relationships, is good. The more I can learn in multiple ways, the more my brain is getting it in different ways, which facilitates that communication. But that's a really interesting thing to say, actually. I hadn't quite thought of it that way, and that's great. Yeah.
I'm just thinking about that question and wondering if that's part of the explanation for the increased results in math performance and reading performance if you actually have a physical exercise routine associated with it. And I think that those studies were conducted in Saskatchewan, I believe, with some classrooms of special needs adolescents where they used cardiovascular machines to improve their results.
Yeah, and there are some ongoing studies right now specific to FASD that are also looking at the impact of cardiovascular functioning and learning, and specifically looking at sustained cardiovascular, so I think it's about 30 minutes, as it impacts learning. And we know that what it does in terms of, so part of it is what's happening in the brain at learning, but also part of a lot of what they're looking at with those studies is the way in which it readies the brain for learning. So you engage in that cardiovascular activity first, and then with the increased oxygenation, and there's other chemicals and other things that are going on that they're looking at in particular with the brain that are altered and prepared for better learning as a result of that. So, I mean, at once upon a time we thought, oh, get kids active because then it burns off steam and they sit and learn and pay attention more. And there may be some value to that, but what we do know now is that cardiovascular work time actually chemically alters the brain in such a way as to potentially improve learning. And that is, I say potentially because with the FASD population, the research is still underway. And there are some exciting studies that are going on in BC and Ontario right now, I think. Yeah.
I have another question, Jackie. I was interested in your comment about, or maybe it was you, Carmen, who said that you were going to reduce the parent involvement in the MILE study. Mm-hmm. And so I'm really curious about that, because I know that in the world of mental health, particularly with children and adolescents, that there's no question that parental involvement improves outcomes. And so I'm wondering what you're expecting to find by doing that, and what you would do if, in fact, you found that it significantly decreased the results.
One of the reasons the parent component was really cumbersome that they did in Atlanta. So it was a lot of work for the parents, and we want to make this as appealing to the parents as well, so it won't be a lot of work for them. Like I said, they were bringing them into their lab. They were also having sessions, individual, like meeting with the researchers each time to go over the skills and everything like that. And I do think that's important, but we wanted to reduce the demand on the parents' time, because I know a lot of these parents are very busy. And also, if we're doing it in the school system, we're not going to be seeing the parents at every session. That was another thing. So, but we still are doing the overall workshops with the parents at the beginning. I mean, if it turns out that none of this works because there isn't as much of the parent involvement at home, then that would be important as well. And then I guess we probably would look at reapplying the parent strategies in a next phase. But we're pretty confident in the program that just doing the tutoring with the child will be effective as well. And the thing is a lot of these children are in and out of different foster care situations, whereas in Atlanta it was a very different situations. Most of them were not in foster care, and it was easier to directly communicate with the parents. We still want a program that's going to benefit the child, even if there is no active caregiver that can work on it, and even if they are moving from situation to situation, we still want something that can be done with the child. And so that's kind of where it's at right now. We still will be doing the workshops with the parents, and we're still hoping that the program is effective. We still think the parent piece is very, very important. And when we're talking about next steps, about implementing it in the school, it also would be to look at implementing these things at home as well, not just in the school. So.
Mm-hmm. It's always a great question, because that idea of negative results, what happens if you do something and it doesn't work, is important. But I think what Carmen said is it's just as informative if it doesn't work. It tells us just as much. If we do all this and we find out nothing happens or we don't get the same results, then we know that the most important part is what's happening with the caregiver, not what's happening in terms of the nuts and bolts. Not that we necessarily can have one without the other, but it does speak to where do we put our efforts, and how do we invest our efforts, because we can't do it all. Mm-hmm. We can't do every intervention in every aspect. So how do we look at tailoring interventions in a way that will make them most generalizable, most accessible? And right now, this is we'll do that. I mean, if we can find something that we can kind of inject into the school system that's doable with the schools, then that's ideal, because we'll get to the most kids and probably have the most participation and see the greatest impact. The higher the load on parent involvement, the more we're going to find it difficult to make it meaningful or else feasible. Mm-hmm. And so part of it is those. But you know what? If we don't see the results, then that tells us, okay, well, hang on, back up the bus. How do we make a parent component feasible? Mm-hmm. That's then the next question. We come back to looking at those three aspects. Is if we find it's no longer meaningful and effective when we take that out, then we have to go back to the drawing board and say, okay, parent piece is important. How do we make that feasible? How do we engage parents at that level in a way that's going to make sense for the most amount of kids, in a way we can actually afford to do beyond just a study?
Well, it also speaks to a social policy question of how do you make it possible for parents to parent.
Yeah.
With the socioeconomic climate being what it is.
Mm-hmm. Absolutely. Absolutely. And asking questions about demands and loads on parents and how we take care of caregivers. Yeah. And the more load we put on caregivers, the harder. I mean, as Carmen said, we're talking about very busy families. Mm-hmm. And they're just kind of, I think about what my nights are like, we're just kind of getting by at the best of times, and these families, redefine busy. So the bigger their load, the more we have to say, okay, how are we now taking care of caregivers, and how do we have our cake and eat it too? we want it all. So we'll see. And as Carmen said, in a year, we'll let you know. And if we say, yay, it worked anyway, then away we go with the schools. And if we say, no, it didn't, we go, all right, snap, now what? And then we come back to the drawing board and we talk to a lot of people. We say, okay, now what can we do? And that's how we all work together and communicate together.
I think that wraps up the question part of the presentation. So I'll just ask Colleen to say a few last words. Thank you, Jackie. And
thank you very much.
Once again, I want to sincerely thank Dr. Rasmussen and Dr. Pai. We are so very fortunate to have these bright, personable young women working in our province. They are the kind of researchers we welcome into schools and communities. Evaluations will be emailed to you in the next 2 days, so please sign the attendance sheet so we can get an evaluation to you. The FASD Learning Series will continue next school year, beginning in September. For this upcoming year, we would like to focus on implementation and interventions that work to support individuals and caregivers. We continue to welcome your topic suggestions. Just a reminder, the Learning Series sessions, including Jackie's and Carmen's most recent presentations on literacy and memory, are on the FASD CMC website. Finally, thanks to all of you for your participation and for the work you do every day to make a difference for others. Thank you.